All right, my name is Jack. I have my research partners Phoebe, Ryder, and Brody here, and today we're going to be talking about long COVID. Ryder, what is long COVID?
So long COVID can present itself in two different ways. It can either be when symptoms come back after you get COVID-19 the first time and your symptoms go away and then they come back 4 weeks later usually, or it can be when your symptoms last for more than 2 weeks. Now I'm going to pass it over to my research partner Phoebe to tell you about the symptoms.
Just before we talk about the symptoms, I do want to add that all of this isn't really definite, like there's no end to it. It's still being studied. We don't know much about it. We just compiled all the research we got, and then now I'll tell you about the symptoms. So you will have fatigue and a fever. Symptoms typically get worse after a physical, or if you have something physical that already happened. It can also affect your lungs, so it includes difficulty breathing or shortness of breath. And there are also neurological symptoms or mental health conditions such as including difficulty thinking or concentrating, headaches, sleeping problems, dizziness when you stand up. You can also have a loss of smell or taste, and you could get depression or anxiety. And also you'll have joint or muscle pains. I'll pass it on to my researcher, Brody. We'll tell you about the rest of the symptoms.
Alright, so the second half of the symptoms. You can also have heart symptoms or conditions which include chest pain or an elevated or pounding heartbeat. You can have digestive problems including diarrhea and stomach pain. You can have blood clots and vascular issues, including a blood clot that could block the flow of your blood to necessary parts of your body. And while it's clear that people with certain risk factors like high blood pressure, smoking, diabetes, or obesity are more likely to have a serious COVID-19 sickness, there isn't a clear link between the risk factors and long-term problems. In fact, it can happen to anybody who's had COVID-19. And now I'm going to pass it back to my research partner, Jack, who's going to tell you guys how it is caused.
Okay, so long COVID mainly comes back when the variant, which is called SARS-CoV-2, reappears in someone's body. And then it can also come from an overactive immune cells that may release high levels of inflammatory substances that can also injure many different organs and tissues. An infection also may cause the immune system to make antibodies that attacks a person's own organs and tissues. And then now I'm going to pass it back to Ryder to talk about who it affects the most.
So some of the highest risk factors are people of the female sex, people that are on the older side. It also depends on the severity of your initial COVID-19 illness, and then also your immune system's response and to the initial infection, also not being vaccinated against COVID-19, as well as pre-existing health conditions such as diabetes, lung problems, autoimmune diseases, and obesity. Now I'm going to pass it to Phoebe, who will tell you about the after effects.
So individuals who experience COVID may be suffering other illnesses which can lead to severe organ damage. So organ damages can include effects to the heart, kidneys, skin, and brain. It also affects your respiratory, cardiovascular, neurological, gastrointestinal, and musculoskeletal systems.
So do you guys know of anybody who has had long COVID?
Well, I actually heard that an F1 driver, his name is Lewis Hamilton. In 2020, he got COVID, and then a couple months later, he was complaining how he was getting more tired during the races because he said that he couldn't train as long or he would get fatigued more quickly, and that's been really hurting his performance. Especially through the corners. Because they're pulling like 5 to 6 Gs going sideways, they have to have a really good lung capacity to be able to like maintain their chest through that corner. And with long COVID and him having damaged lungs, he said it's really hard to keep his breath in without exhaling through the turns, which makes him really out of breath on the straightaways and between turns, especially on street circuits where it's tighter and they're going into corners more often. He's had a really hard time in Monaco and places like that, and you can actually see he's performed significantly worse in the race compared to longer tracks.
Why do you think we haven't talked about long COVID much or like heard about it that much?
Well, as we're still researching a lot, we don't know a whole lot about it. As far as we know, it's just still a part of the whole COVID-19 process of just going through the illness and everything. But it's also kind of hard to talk about just because, if you said that if you got diagnosed with COVID like 3 months prior and you're still feeling symptoms and you keep saying you have COVID, people probably won't believe it. So we don't know enough about it to really talk about it like as much as we should have.
Also, I want to add that a lot of famous people who were or would have long COVID don't really talk about it because it could affect their job, and then they could maybe not have the job anymore or whatever. And also it affects their social image a little bit, so they don't really express it out to the public just out of nowhere.
All right, do you guys know if long COVID has by chance led to any deaths in the past?
Well, I don't think there's any confirmed deaths due to long COVID. There's a lot of research going into if long COVID can cause death, as well as a lot of suspected cases where they think long COVID was the cause of death. According to a study done by the journal Nature, they said that up to 8.39% of per 1,000 patients died due to long COVID. Again, that's not completely confirmed, but that is after a large study was done on long COVID fatalities. Do you guys know like how the public's reacting to this?
I feel like there are different reactions like all around. Like some people are like, oh, whatever, it's part of COVID, it doesn't really matter. And then some people are actually really worried about it and then really thinking more or digging deeply into it or doing more research on it. I don't know.
Yeah, I don't know. It's kind of a weird thing to talk just because we know basically nothing about it. It's hard to tell.
Yeah, I feel like the people that care will obviously like know about it because they'll want to learn about it, I guess. And like the people that don't care as much, like they have no clue. So
yeah,
I
think
feel
that's
like
where it is.
I feel like the main way that we get information about COVID is through
like CDC,
the
the
news.
Social
Yeah.
media.
But I feel like
Yeah.
that's a lot of like the younger generation isn't really that concerned about it. I wouldn't say just because a lot of us don't really follow the news or just don't read that kind of those type of news articles. But yeah,
And if we do see it, as Ryder just said, social media, where
Yeah.
else would the
Yeah.
younger generation see it?
But then
Yeah.
again, if you're looking if it's from social media, how reliable is
Yeah,
it?
that's true.
Who,
Yeah,
There's
who
not-
you getting it from? pretty
Exactly.
much, yeah.
Right. Yeah.
yeah.
We've talked a lot about the physical toll that long COVID can have on someone's body, but now let's talk about the mental side.
Yeah, so, I mean, obviously you get, depressed when you're sick, right? You get kind of down.
Because you don't know when it's not when it's not gonna go away.
Yeah,
You don't know how long
definitely.
you can have it for. It can also cause sleep disorders as well.
Mm.
You never know. It could just affect that.
As well as the people who don't really know what long COVID is, they might be worried, they don't know why COVID's lasting so long, and kind of like what you were saying before, they don't know when it's going to go away, which can be...
Stress-related disorders like that, trauma, stuff like that.
And also, it doesn't really just affect them. It'll also affect their family. They don't know when that person's going to be recovered or anything. They don't know when they can go back to their job. So it's if they're the only one providing for their family, then that's going to put a really big stress factor on their family as well.
Yeah.
Definitely. It's people are, afraid of the unknown. So,
Yeah.
yeah, and, they might not be that educated, I guess. So.
And definitely, I think long COVID might end up leading to depression in some case because you're there in a hospital for so long and then it's you just keep going through a procedure, you keep going through medicated things and then you still don't recover and it's it could just lead to depression at the end.
Yeah, especially because you're, out of, how do you say it? Not community, but, you're, out of, social life.
Yeah.
Pretty
Yeah,
much,
yeah,
so.
You're isolated.
Yeah,
Yes,
literally,
there
yeah.
you go. Yeah.
All right, well, that was our podcast. We hope you enjoyed listening.
Thank you.
Thank you. See ya.